Okay, today I'm going to be doing an ostomy on my patient. This is her order. Um, I will be changing her wafer if it is needed, and normal procedures, or also you have to follow your company's procedures, are 3 to 7 days for the wafer to be changed. Okay, knock knock. Hi, my name's Amanda. Close the door, provide privacy. I'm your nurse today. We're going to be looking at your ostomy and cleaning it, and we might also have to change the wafer. Would you like to help me with any of this today? The patient explains no, she already understands and awares of the care and everything. She just wants to watch, but she doesn't want to help. Can I have your name and date of birth, please? Okay, let me check that, Miss Jenkins. That is correct. And you do understand the correct care and everything, right? Yes. Any pain, cramping, or any concerns you have for me? Everything seemed to be going okay? All right. I wash my hands. I'm going to put gloves on. I'm going to go ahead and check, and we're going to look at your bag and clean that out for you, Miss Jenkins. When I check her bag, if it is a third of the way full, I will be emptying it. We don't want it any fuller than a third of the way, or it can get heavy and break loose, and that is not something that we want. I'm going to go ahead and put the bed rail down, and I'm going to put the patient's head down. Okay, Miss Jenkins, we're going to go ahead and take a peek here. Okay, it's a clear bag, so from what I can see, the stoma is pink. No signs of infections from what I see. I'm going to go ahead and empty this for her. I'm going to go ahead get the bedpan ready, and I'm just going to insert this under you. And just lift up just a little bit, Miss Jenkins. Thank you. This is to prevent any soiling. Okay, I'm going to have the bedpan ready to take this out. Okay, I'm going to go ahead and I'm going to unclip the bottom of the bag here. I'm just going to set the clip aside. We're going to go ahead, open this, and we're going to roll this back. Okay. After we cuff that back, we're going to go ahead and squeeze out the contents. Now, if the person has an odor device bag, an odor control bag, we won't be rinsing that with fluid, but she doesn't. So we're going to go ahead and rinse this now, miss, with fluid. Just squirt some water in there and squeeze it out of the bag. Okay, I'm just going to take some toilet tissue at the end of the bag here. And we're going to uncuff that. Roll this back up and reclip the end of this bag here. Now I'm going to go ahead and I'm going to have another pad to throw over this to take this to the toilet. But as I'm taking it to the toilet, I'm going to go ahead and put my railing up. I'm going to look at the color, odor, amount, and consistency. The color is a light brown. The odor is like a normal smell. No blood or metal smells or anything like that. The consistency is runny, but kind of like a jelly-like. And the amount we will measure for intake and output. I will take this to the bathroom after I raise their thing. I will provide her with privacy also while I go to the bathroom. Okay, Miss Jenkins, I'm just going to dispose of this, and then I'll be right back to go ahead and look at the wafer. We'll take this to the bathroom, we'll do our measurement, we'll dump it, rinse it, and dispose of it the correct way. Okay, now I'm back in here. We're going to remove these gloves. We're going to get new ones. Throw them away and say we got new ones. I'll go ahead and wash my hands again. I'm going to put my gloves on. Okay, Miss Jenkins, now we're going to peek at this wafer. Go ahead and lift this over. Okay, I see the wafer is kind of removing, so I'm going to go ahead and remove the bag from the wafer. And then I could just hang this bag up to dry out in the bathroom or set it aside. And then we're going to go ahead and take the old wafer off. I don't have two wafers, I only have one. So we're going to pretend it's on here. To take it off, I see it's lifting here. I'm just going to push down on the skin and pull up on the bandage so the skin integrity stays intact and we don't rip the skin. Push down, pull up. I could use an adhesive remover to help me get it off. If it's not needed, I'll throw this in the trash. Okay, I did put the bed rail down. I forgot to mention that. Since I went ahead and did that, I'm going to open up this gauze, but I'm going to get her wafer off. That was the bag. Then we took the wafer off. Now with the wafer off, I'm going to inspect it. The area is clean. There's no signs of bacterial or yeast infection. It looks good. It's pink, moist. It looks good. Now I'm going to prepare a mild soap and warm water to wash it. Most calls for just water, but a mild soap is okay because if you use any other kind, it will de-stick the adhesive and it won't stick as good. So we're going to go ahead and get mild soap and water. And we're just going to wash around her stoma here. And then we're going to go ahead and give it a different cloth. Get warm water, just regular water, and rinse the stoma off around the stoma. And then we'll get a dry cloth and we'll wipe around the stoma. And every time I'm wiping, rinsing, or washing, I'm changing a part of my cloth so the same part doesn't touch as well. So we clean the stoma. Okay, everything looks good. I'm going to get my measuring device, which I don't have. It's cut with holes, and I would look at this and measure it. And then I would want to take that, open this, and trace the measurement I have on here, but I'm going to want to trace about 1/8 of an inch bigger than my stoma to cut out because you don't want it tight up against the stoma. So once I trace that and figure out my measurement, about 1/8 of an inch around it, I'm going to go ahead in and I'm going to cut this out. I also forgot to mention while I'm waiting, I'm going to cover their stoma after it's clean in case they have any accidents. We don't want that. I did forget, sorry. So after I have my stoma measured and cut, I'm going to go ahead and lift the gauze. I'm just going to make sure that it's good. And that looks good to me. I'm going to replace the gauze again. And now we're going to go ahead and put this on. And remove this. Making sure that it's centered. Make sure that it's intact. The skin integrity was also intact. I forgot to mention that. No cuts, rips, or tears. Place this over that again real quick. We're going to have our bag ready that is clean. And we're going to go ahead and remove this. And then we're just going to snap this over here, making sure it's nice and tight. And it snaps on and is intact. Once that's on and intact, we'll make sure that everything's good. Ask the patient if she has any problems. I'm going to go ahead and Can you roll it just a little bit? Lift her up and remove the waist. And my gloves. Go ahead and wash my hands again. The bag is intact, it just won't stay. And everything looks good now, and she's good for another 3 to 7 days. And how do you feel? Any problems or concerns? Okay, would you like to be sat back up or, okay, I'll sit you back up. Is that good? Okay, I'm gonna go ahead and raise the bar. I'm gonna hand her the call bell. And if you have any problems, questions, or concerns, just go ahead and hit that bell and I'll be with you, Miss Jenkins. Thank you.